Hello, I'm Andy Ward. I'm a GP. I've been a GP for 25 years now, and I'm currently working in inclusion healthcare, looking after people experiencing homelessness. I've worked in medical education for a long time, since 2005 at Leicester Medical School. And as an MB medical presenter, I put together the Migrant Health webinar, which you can see free of charge in our clinic section. It's really helpful if you're looking after people who've come to the UK from overseas. If I was to go back and tell myself as a new GP a valuable lesson that's going to help me in my career, I think about those 4 rules of general practice that David Haslam described when he was president of the Royal College. Shut up, listen, do something useful, and care. Shut up. I've observed hundreds and hundreds of consultations in my medical education role. And the ones that have always gone the best are the ones where the patient has done most of the talking and the clinician has done most of the listening. And learning to shut up and allow the patient to talk is quite a skill, and it will make your consultations go easier. If you do that, you do need to listen though. You need to pick up those cues. You need to sort of demonstrate you're listening to the patient. And if you do, you're more likely to get the diagnosis right, I think. And I go back to what William Osler said, who was the father of modern medical education. Listen to your patient. They are trying to tell you the diagnosis. Well, clearly you need to listen to achieve that. Doing something useful, well, you need to keep up to date for that. And NB is actually brilliant for keeping you up to date. I really recommend using the webinars to boost your knowledge and make sure you're abreast of the latest guideline. It's such an important part of our role. And finally, you need to care. Keep the empathy you've got. Be interested in your patients. Try and find out more about them than just why they've come to see you. You'll have a much more interesting life as a GP if you do that. And your patients will think a lot more of you too.